All right, today we've got a story that is, well, it's one of the most ambitious we've ever come across. We're talking about a company that started with just a tiny bit of cash, but has a plan to build a high-tech health grid for an entire nation. So, let's dive in and see how they plan to pull it off.
So yeah, the big question is, how on earth do you even do that? How do you dream of building a national AI health system when your starting cash is less than what most people pay for a new phone? It sounds absolutely impossible, but stick with us because this story gets really, really interesting.
Okay, to really get a handle on this massive vision, we've got to go back to the beginning, like the official beginning. On paper, this whole story kicks off with a simple corporate filing.
So you look at the paperwork, and honestly, everything looks completely normal. Samriddhi Pharmaceuticals Private Limited. It was incorporated on June 6, 2024, out of Varanasi. It's a private company, 2 directors, and its stated purpose is to manufacture of medicinal substances. Nothing here screams AI or national health grid. It just looks like, well, a small company.
And this is the number you need to remember. The paid-up capital, the actual cash put in the bank to get this thing started, was just 10,000 rupees. That's about 120 US dollars. Just keep that number in your head, because the contrast with what's coming next is just wow. So the government filings are one thing, but then you start digging a little deeper, you look at the company's public profile, and a totally different picture starts to emerge.
And boom, here's our first clue. The company says its mission is to connect ancient Ayurvedic traditions with what modern consumers need. It's all about making traditional wellness safe, affordable, and transparent. Okay, a noble goal for sure, but it still doesn't exactly scream national AI surveillance system, does it?
And if you look at their strategy, it's all the stuff you'd expect from a modern wellness brand. You know, they're talking about clean label, plant-based products, everything is sustainable, it's a direct-to-consumer model, and they're focusing on smaller cities. So far, it looks like a pretty typical socially conscious startup, but this is just the first layer of the onion.
And right here, this is where the story takes a massive plot twist. Because all that stuff we just talked about, the Ayurvedic products, the business model, that's not the real plan. Not even close. The company itself calls this their main project. See, the really crucial thing to get here is that the entire pharmaceuticals business, the thing they actually registered the company for, is just a means to an end. It's the front door to a plan that is on a completely different scale.
And this is it. This is the real deal. Project Swasth Bharat AI, an integrated digital disease surveillance and Ayurvedic care system. This is the true vision. A plan to build an AI-powered early warning system for epidemics all across India. All of a sudden, that 10,000 rupee company doesn't seem so small anymore, does it?
And why are they doing this? Well, they've spotted a huge, critical problem in India's public health system. Epidemics often start in these remote, rural areas and just spread silently. There's no easy, real-time way for people to report what they're feeling in their own language, and there's no cheap way to connect them to a doctor. This is the problem their AI is designed to solve.
Okay, so an AI health grid sounds massive, and let's be honest, kind of complicated. So how would a system like this actually work in the real world? Let's break down the main parts. Think of it like this. The whole system has 5 main parts that all work together. You've got the simple stuff like mobile apps and kiosks for people to use, an AI video doctor for diagnosis in different languages, a smart engine that maps out symptoms to see trends, and even an online pharmacy. And the key part? It all plugs right into the national health dashboards. So let's walk through an example. A villager feels sick. They use an app or a local kiosk to report their symptoms. Instantly, the AI is on it, analyzing the data. Now, if just 5 similar cases pop up in that same village, bam! An automatic alert goes straight to the local health clinic. And if that number hits 50 in the whole district, the alert gets kicked up to the state level. This is all happening in real time. It's basically a digital tripwire for disease outbreaks.
But how do you actually get this technology into hundreds of thousands of villages? Well, they've got a really smart plan for that. A super low-cost franchise model. They're calling them Swasthya Seva Kendras, or health service centers. And get this, a consultation costs just 20 rupees. It's incredibly affordable. The goal is to create 100,000 new rural micro-entrepreneurs to run these centers.
So that franchise model explains how they plan to do it. But it's the sheer scale of this vision that is just, honestly, it's hard to wrap your head around. We are not talking about some small pilot program here. The plan is to go from village to nation at lightning speed. Just look at these numbers. The plan is to roll this system out to 100,000 villages and 5,000 major transport hubs, like airports and railway stations. And the craziest part? They want to do all of this in just 2 years. The ambition is just off the charts.
And here's how they see it playing out. Year 1, launch a pilot program in 10 states and major airports. Year 2, full-on nationwide expansion. And they're not even stopping there. By year 3, the plan is to start exporting this entire health model to countries in Africa and Southeast Asia. This is a global ambition.
So what's the secret sauce here? What makes this whole thing tick? At the end of the day, it's this incredible fusion of ancient Ayurvedic wisdom with the most modern technology out there, artificial intelligence. It's tradition meets tech. And that's what they believe makes this whole project so powerful and unique.
And it all boils down to this. This is their mission statement, their North Star. 0 epidemics, 0 delay, 0 distance to healthcare. I mean, you can't get much clearer or more powerful than that.
So when you step back and you look at the whole journey, it's pretty extraordinary, right? It all starts with this tiny, almost laughably small 10,000 rupee company registration. On the surface, it's a modern wellness startup, but hidden underneath it all is this moonshot vision for a national AI health grid.
And that brings us right back to the question we started with. Is this brilliant? Is it audacious? Or is it completely unrealistic? Can a company that started with just 10,000 rupees really build the technological backbone for an entire nation's healthcare system? That's the question we'll leave you with.